Would you like a second opinion on your finding? Then send us your analysis and medical history to visit at QS24 TV, and the chief physician Dr. Wiechel will analyze this for free and anonymously in our new broadcast format visit. Learn more at www.qs24.tv.
Welcome, dear viewers, to our new format, Natural Medicine. Today I would like to discuss a topic that Dr. Dietrich Klinghardt suggested to me. He said I should do an examination to see if I have a HPU disease. Because of the chelate excretion, he found that a lot of my body was lost. This hardened the suspicion. I have no idea what a HPU is. The broadcast time was not enough. But I have an expert here, a clinic director of the Swiss Mountain Clinic. She came to us today, Dr. Petra Wiechel. Welcome, dear Petra.
Thank you.
For you, this HPU is not an unknown thing, right?
No. It is a form of basic diagnosis that I do. Because about 15% of the population suffers from such a mostly unrecognized metabolic disorder. It has two big clinical differences. One is people who suffer from a HPU. These are super intelligent people who often can no longer structure themselves well in their lives. Einstein was a HPU patient. Darwin, Charles Dickson was a HPU patient. These are people who have a small deficiency in the pyrolytic metabolism, in the blood, that they simply excrete zinc and vitamin B6 from the urine. That means it won't be noticeable when I'm small.
But I don't have a zinc deficiency. I have a lot of it. But I lose it through the chelate excretion.
Well, now you have to look. Either you are a HPU patient or you are not. You don't know it yet. It's just a thought. Because we keep observing that people get sick. Sometimes they get sick very early and ask us what conditions actually cause a burden. And that is individually different. And that is much more often than we think. So, for example, in autistic children 70% are HPU children. Or they have ADHS. That's 50–80% HPU children. Because these children or these people lose zinc and vitamin B6 through the urine every day. And that's actually a story when the children develop allergies in childhood. Or, for example, become so hyperactive. They can't really concentrate that well. They are super smart. They are highly active mentally. But they find it difficult to find their own peace. And they often quickly get the stamp of the hyperactive and are treated with Ritalin. And you do the children so wrong. I had a couple of siblings, 2 young girls. One of them developed psychosis at the beginning of her studies, when the performance was really required. And the other sister had schizophrenia. No, it was just HPU, family. It was like a nest. Even the father had developed completely different diseases because of these 2 deficits. And both girls are now totally healthy today. And that was all well and good. But of course you have to substitute here.
Is it easy?
Yes, of course it's easy. But getting sick, for example, also having a chronic viral infection over and over again, getting an infection, triggering an autoimmune disease. Zinc is a multi-talent of the cell. That means without zinc, nothing works in the cell. Whether you develop a reactivated Epstein-Barr strain or a zoster, a herpes virus, there is a zinc problem. And this intracellular immune system is zinc-dependent in its economy. Mitochondria are also dependent on an optimal zinc level. Zinc is the trace element responsible for 400 enzymes. That means the reaction can't go from A to B if zinc is not there sufficiently. A lot of people, for example, have weak diamine oxidase. They can't build off histamine. They develop allergies again and again, a heart attack after eating, or also headaches, neurological symptoms. They can't build up enough of this diamine oxidase, because it's dependent on zinc and vitamin B6 so that it can build up again and again. And these HPU patients, as I said, excrete this zinc every day. And now, of course, the question is my need increased? Because if I have a toxic burden now, then of course I need a lot more substance to invest in my detoxification now. The liver is also zinc dependent in its detoxification. Zinc is also responsible for all the regeneration of the nails, the hair, my skin. That's zinc dependent. There's hardly a skin disease. And the question is there a zinc deficiency? You can't measure zinc in normal blood and serum, but you always have to measure it in full blood and intracellular, because zinc is 70% in the cell, not outside the cell. Sometimes you have normal zinc levels, but if you look at how it's measured, then this zinc level is not relevant. The zinc measurements are also very often done via a heavy metal test, via the connective tissue. And I saw Dietrich Klinghardt when I visited him in Seattle. And he said, "You don't have this test, it's a Swiss device." I wasn't even home yet, I had him there. But he told me that he had been measuring what he had measured here for 6 months and then in blood or urine. And that's why it was so clear to me that I would of course integrate this test method. And we measure in connective tissue. And sometimes I see a very high zinc level in ligament tissue. And then people could think, well, then I have enough. No, the zinc has to go through the receptor. But if the receptor is operated on with mercury or aluminum, zinc doesn't find an approach. Now I may still have the excess as a pyrolic, and now I may still take zinc, and it stays in the ligament tissue. It cannot be absorbed intracellularly. That's why it's so important to understand why zinc is enriched. The pyrolic brings it out faster, but the other patient cannot introduce it intracellularly. Zinc is responsible for activating T lymphocytes. That's a very important immune cell that activates the natural killer cells. And B lymphocytes, that is, in tumor defense, in viral defense, without zinc, the activation, the development of such cells does not take place. So zinc, as I said, is the multi-talent. And I'm really quite shocked how few people take zinc. And you have to know that zinc is not taken well either. So of what you take, only 30% is absorbed via the intestinal mucosa. That means it's always a matter of you can only make 15 milligrams in a tablet. Every zinc preparation must be prescribed if it is higher than 15 milligrams. But my dosage, we always test it, sometimes goes up to 45, 60, 75 to 100 milligrams. If I have seen exactly where the cause is. And zinc deficiency then of course also causes on many levels, and the pyrolic often has it often, on autoimmune diseases, psoriasis, skin diseases, allergies, neurodermatitis, that's all asthma. These are all things that have to do with it. But one is the loss of zinc. And the other is vitamin B6. Vitamin B6 is the most important nerve vitamin. And thus of course also for the cerebral development, for the mental development, for the cognitive development. Vitamin B6 is built into a multitude of enzymes. I have already mentioned the amine oxidase. That means there are a lot of people under B6 deficiency have headaches. That's the B vitamin for migraines. And so it's actually always the way the composition. There is a preparation that actually contains everything. Zinc and B6. Yes, but vitamin B6 loss also has the consequence that selenium and manganese and magnesium come into a deficit.
I also lose everything so strongly according to these values.
Exactly, yes, but as I said, there are again these influences, these minerals that need each other. And then also come into the deficit situation. And you have to do that with active vitamin B6 and with this combination really well and long. I would never lead anyone out and don't know if he's a pyralic.
That also amazed me. I mean, I've never heard that either. But first they told me about a Klingharten, I should go to you. I say, I'll do it now. I'm allowed to do a liver detoxification now. Are we also doing a HPU test there?
Yes, I want to do that. Because I always want to look at it. Because patients who come, I already know a little about their concerns. And I always discuss that on the way in. Let's tackle these and those things. Because certain things, you always have to, without having a look down to the depths, but certain things are vital for the course of a liver detoxification.
I think I still have to take the camera with me. That would be exciting. Another question, where you said earlier that killer cell production is always related to zinc deficiency.
Yes.
Does the oncologist know that?
I don't know if he knows that. He doesn't really know that before he even starts chemotherapy, he should know how well the person can detoxify. Because if he works with a chemotherapeutic and has no good detoxification, only perhaps because he has a selenium deficiency, then he will burden the liver with a toxin that detoxifies from A to B. An even more highly toxic intermediate product is created in the liver. And he can't do it in a kidney way, that it is excreted. That's the utmost responsibility. If I decide a therapy, I have to clarify that this person can detoxify. I don't want to judge, but I think it has something to do with responsibility. And I wonder why people always have liver metastases and they think that's from the tumor. Is it perhaps also due to a toxicity that can no longer compensate the liver? No, he doesn't know that. And I could well imagine that a process has to take place that we somehow get our people through such a therapy, which then also has a success. And don't look at them one-sidedly and focus our focus solely on something bad. Because it's not bad and it's never bad. It's just that it's developed in me. It just got a self-dynamic. I've been looking for another name for this disease for years. I don't think cancer is a nice name. It should sound much warmer. Because at first it's just to be understood. And if it is understood, then we will treat it differently. But we adapted a thinking that we have to destroy this process as quickly as possible.
We shoot him with everything we have.
And destroy the friend with it. And he's a friend. It's not an enemy in which he grew up. That remains a friend. And we destroy everything. That's something I think it may also be more the question of the patient. How can I best maintain this balance when we choose such a therapy? How good is my body with it? Is my body able to compensate for this therapy? Apart from the fact that, of course, a sensitivity test is never done in advance. Is that my medicine? Or does it have a higher side effect than benefit? Tumor markers go up and then the next one is taken. Because no, I can know beforehand how well this drug works against this tumor disease. If it should be like that. To keep it very tight.
A friend of mine whose wife has had a brain hemorrhage. And they found out that she had a hole around her heart. And now she has to operate and close this hole. I just asked the question to my friend. They then clarified why this hole was created. It can come back. And he said, no question, nothing at all. I said, go to Swiss Mountain Clinic. Let's clarify that. It must have a reason.
The number of brain hemorrhages has increased immensely after we set up here with all the pump loads.
Oh no, honestly, is that a connection again?
Of course.
We don't know what we're doing here either. Okay. And they found a connection to the heart. Somehow a hole. You have already found this connection.
Yes, and above all you always have to look much, much deeper. I can't pull that out of the drawer.
Just told them pull all the data together.
It's always the look at the whole thing and then you can't understand. Here is a hole and here is a bleeding. Then it hasn't been the way it should be here for a long time. So it's hard for me to always give the recipe for anything. Because that can't be. Everyone is so individual. And different things contribute to it. Every body has its weak point somewhere. And it is precisely at that weak point that disease also shows up.
Let's go back to HPU, please. How can the viewer at home notice that he or she may have the suspicion of having a HPU?
Yes, there are various laboratories that offer this to examine a HPU. There is a Dutch laboratory that takes a 24-hour urine sample. You can do it all by yourself. There is also the laboratory in Germany, Ganz Immune, for example, that does it. A morning urine. It is only important that you know not to take a B-complex preparation a week in advance. And please no zinc either. And then just collect some morning urine. It has to be a special tube. You then ask for it as a consumer, and send this urine in and get a value. And with this value you can act immediately.
But my question is more in the sense of how does he notice that he could have it?
Well, by thinking about all the things I just said. By realizing that he can't concentrate psychologically sometimes, that he can't sleep well, that he may be great math, but he can't remember vocabulary, for example. They have a bit of a problem with short-term memory, their problems, skin diseases, the nails are brittle. If zinc is missing, you have little dots on the nails and you sometimes have cross stitches. They are gone again after 4 to 5 months of substitution. By having headaches and not being able to classify them. Skin problems, I said, autoimmune diseases, allergies, food intolerances, stomach problems. So if you're a little busy. In the clinic I have a nice article about this HPU. I always give it to every patient. It's also out. You can also ask for it if you want. But these are all important things. Or HPU. There are now enough books. Kira Hoffman wrote a very nice book about HPU. And a disorder in the pyrrole metabolism. And as I said, a metabolic disorder, which is ultimately the cause for an allergy. A food allergy. Here it's called migraine. Then it's called psoriasis, because it's an autoimmune disease that has already developed. But to overlook that. I always want to not overlook that. To always integrate that into a treatment, which then gives me the prerequisite that I can take the next step.
Great. I'm also looking forward to our new broadcast format, Visits in Biomedical Medicine, which we can start tomorrow for you, dear viewers. And viewers who are always allowed to be broadcast on Sunday evenings, where it's really about these cases from life, what viewers experience at home.
Yes, maybe it's not even the case. Because then there's not that much time. But just questions that you have in your heart. which may simply give you things in your hand again in the process of responsibility. To question them again consciously. To see the way. And God, don't endure anything unnecessarily. The body is always and at any time so grateful for all the help. And He does it. It's incredible. He does it. We just have to trust Him and understand Him. Then it's a lot of fun what you see there.
Thank you very much. For me, it is always a blessing to be allowed to speak to you. I repeat myself, but there is always another viewer here.
Exactly.
And that's why it's important to say that. Because I always learn, you can't just work with the clutches. You have to learn to understand the body. And to participate on this level. That it is in a balance.
Sure. And also give time. Give patience.
And the state you have now is not bad, it's great. But actually the most meaningful answer. In terms of circumstances. You're right, the word cancer has to go. Because that's a totally negative association. And that does a lot up here.
Yes, and above all, if we could give him a new name. And that we want to understand it at the beginning as something. How it arises. We have now been dealing with how we can destroy it for 70 years. But then I think you would be in a great peace of mind from the first hour. And can also get involved yourself. Really bring in. Because there is immensely a lot to do. When such a diagnosis comes. And you do so much hesitation and pressure and stress. So that I'm in these consultations. I'm happy to be there for a second opinion. Actually, my most important task is to first ground. And to say, and in peace, now we ask first, how can this happen? And then it is important in the future anyway. How can your body do what it could do 30, 40 years ago? Because he has the best anti-tumor program himself. That happens every day.
Yes, of course. And if you ask yourself, the last 70 years, we have actually been with chronic diseases. Pure school medicine has not come far.
Yes, further in a direction that they are increasing. So 70% are considered chronic. And I wonder, who takes that in their mouth?
So it's high time to really introduce biological medicine. And to ask yourself, why could it come so far?
Right.
These are the right questions.
I think so too. And if there are no answers, it can't be in the game either. You can only say, thank you, then I have to look further. But by no means take anything as given. But there are more and more attempts to bring in. That brings you really far. I can just watch that.
Who is it for? I sometimes wonder when I hear and read business news. And hear exactly the same. You have to ask, why do I have this? And if I get the answer and not just because it is so, then I'm on the right track. Thank you very much, dear Petra.
With pleasure.
And you too, dear viewers. Thank you for joining us through this program. I wish you all the best. See you next time on